Okay, this is my discharge teaching assignment. Hi, how are you?
I'm good. How are you?
I'm good. You ready to go home?
Yes.
Alrighty. So I have a bunch of papers here, and I've got a lot of information that I'm going to just throw at you right now. So
Right.
I'll give you the papers to review back with.
Okay. I can't wait.
I've noticed Dad is not in the room. Is he coming back?
He's in the cafeteria. He got hungry.
Oh, okay,
Yeah.
fair. Yeah. All right. So
I'm hungry too, but you know.
Before he gets back, I do want to let you know that this can be a time of a lot of change in family. Obviously, you can tell with new baby, and sometimes relationships that were healthy before can have a new dynamic to them that maybe isn't as healthy. So on this list, there is the number for the domestic abuse hotline. Call it if you ever worry. You need to stay safe.
Yes.
So with that aside, we'll start with you. For your health, you're going to need to make sure that you increase your dietary fiber, calcium, and water. You can do that with fruits, the fiber with fruits, cauliflower, oats. With the calcium, you can do dark green leafy veggies, milk, dairy products, water, of course.
Mm-hmm.
And then you're going to want to avoid sugary, caffeinated, and alcoholic beverages. I know it's a little bit longer. You'll be okay, I promise.
Okay.
And then for your activity level, I understand you were fairly active before all of this. So you're going to want to slowly increase the daily activities. You'll need a lot of rest, but slowly increasing back to your baseline. And for the first 2 to 6 weeks after delivery, we do recommend that you avoid lifting, pushing, or pulling, and driving, at least until your doctor gives you the okay for all of that.
Okay.
And you may have noticed that your breasts have changed in size and your nipples have changed in size a little bit with pregnancy. Yeah, that's totally normal. You'll just want to wear like a supportive or fitted bra for the next few weeks.
All right.
And then have breast pads because your nipples will leak for the next few weeks as well. And that can be kind of uncomfortable, especially if it's kind of hanging out in your bra, on your shirts, that kind of thing. So we recommend breast pads to put in your bra until that stops. And then if you are finding your breasts are a little uncomfortable, you can use an ice pack in between feeding to help with discomfort. Just don't place that directly on the skin and not for longer than about 15 minutes. Will you be breastfeeding?
I will not be breastfeeding.
Okay. So for the next 3 to 4 days, you're going to want to wear a very supportive bra and avoid breast and nipple stimulation.
Okay.
Don't pump, don't feed, not even to relieve. You're going to have some engorgement, but you know, you can use a cold compress, cold towels for about 15 minutes at a time as needed. And you
I've heard cold cabbage works as well.
Yes, cold cabbage leaves can help with that too. You're just not going to want to apply any of that directly to the skin, except for the cabbage, of course. Okay. And avoid getting heat on your breasts. So we don't want to stimulate any milk production or anything. I'm sure you are a very frequent hand washer, but you're going to want to keep that up.
Okay.
Wipe front to back when you use the restroom, and use a peri bottle with warm water to clean after a bowel movement, urinary movement, any of that, and change your peri pads frequently.
All right.
Should have a peri bottle and some peri pads in there for you.
All right.
Some vaginal bleeding is common. It'll decrease in amount, or at least it should, as you go along through your recovery. The color will change from a bright red to like a pinkish, and then a brown into like a yellow or cream over the next 6 weeks to 2 months.
Okay.
And then after that, your menstrual period can begin again. So that is awesome.
Unfortunate.
Unfortunate indeed, yes. So for your bowel movements, we don't want you to be constipated. Nobody wants you to be constipated.
I don't want to be either.
No. So you're going to want to make sure to take a laxative or stool softener until your bowel movements are normal. And again, increase those fluids and the fibers like we talked about.
Okay.
And then going back to the menstrual cycle starting up again, you'll want to discuss your options with a healthcare provider for what you can use for birth control in terms of postpartum. A lot of times they'll give you a pill, sometimes shots, those kinds of things, but we'll talk to them about that. And then for the first 6 weeks after discharge, you're going to want to avoid anything going in your vagina. Definitely wait to have sex until the bleeding is stopped, and until you feel ready physically, emotionally, mentally.
Yeah, hubby's gonna have to wait.
He is, yes, and he can't force you to do anything.
Absolutely not.
So there's a few things that you'll want to report to us, to your healthcare provider immediately. So that would be pain, redness, warmth, drainage, or foul-smelling discharge from your incision.
Okay.
I know you got a C-section, correct?
Yes.
Yes. And then you're also going to want to see if that incision is opening at all. That's not good. Check for any foul-smelling discharge, severe headaches or visual changes, a temperature over 100.4 or feeling like that cold, feverish feeling. If you have any thoughts of harming yourself or baby, pain or burning and redness and swelling in your legs, especially your lower legs, and especially if it's one leg only.
Okay.
Painful or swollen breasts or sore spots with like redness and streaking and flu-like symptoms.
Okay.
And then any sharp pain in your abdomen, chest, breasts, shortness of breath, dizziness, faintness, any crying spells or uncontrolled mood swings. I'm not going to lie to you, you're going to feel a little wonky for the next few days. You just had a big hormone shift. But if you feel anything that is really out of control, really, really far from baseline, definitely report that to your provider.
Okay.
And if you're unable to empty your bladder or have painful urination, kind of like with a UTI, also report that. And then any difficulty with your bowel movements, and then here's that number that I was telling you about right at the bottom here.
Okay, thank you.
If you need that.
Better not.
I agree, but just in case. So for your infant, for safety, you're gonna want the baby to sleep on their back. For sleep clothing, just like a onesie. You don't really want to wrap them up in blankets or pillows or any of that in the crib with them. Just a firm mattress with a fitted sheet in a approved crib.
Okay.
And then you're not a smoker, but
Nope.
don't let anyone smoke around baby. Not great for their little lungs.
Absolutely not.
And then it's totally fine if they sleep in the same room as you, but we don't recommend them sleeping in the same bed.
Okay.
Because I'm a soft mattress believer and babies need firm ones. So you're also going to want to keep a bulb syringe nearby to use in their nose or throat.
Right.
And then if you're going to clean that, use warm soapy water and let it air dry.
Okay.
Wash your hands frequently when caring for the neonate. And then I saw your car seat over there. Anytime the car's in motion, baby needs to be in the car seat.
Yes.
And then this one might seem a little strange, but when you go home, you're not going to want to like put any signs or banners on your house letting people know that you have a new baby at home. People can be very weird and suspicious. So if you see anyone coming up asking about baby, trying to see baby that you don't recognize or is unfamiliar, definitely you want to question that, report it. Nobody from our hospital will be going home to check on you. If it's DCF, they will let you know about that. But yes, you want to be careful, making sure baby stays with you. And then as for infant behavior, they're going to cry.
Yes.
They're going to cry and cry and cry.
Oh,
and cry.
yes.
This is a very normal response. Usually it's for hunger or if they need a diaper change, maybe if they need to burp. So you're going to want to make sure you burp them after each feed to kind of keep that from happening. For calming, you're going to want to feed them and change their diaper. If that still doesn't work, rub their back or tummy, walk them around, rocking, skin-to-skin contact. Especially since you're deciding not to breastfeed, that is something you're definitely going to want to make sure you get lots of skin-to-skin.
Okay.
Giving the baby a pacifier if you decide to go that route, but just don't shake them. It can get very frustrating for new parents. It's very normal to get frustrated, but if you're finding you get to that point, put baby somewhere safe, take a step back, take a breather, and come back. As long as baby's safe, it's okay for them to cry a little bit. Better a safe baby than a hurt baby.
Yes.
So babies are also going to require a lot of sleep, as you can see. They're napping right now with their eyes open. You're gonna want to wake them every 3 to 4 hours for feeding. So I know nobody wants to wake a sleeping baby, but again, you want them to eat. And then you're gonna want to make sure they get some tummy time in, supervised, of course.
Okay.
It helps strengthen their neck muscles and their abdominal muscles, those kinds of things. So you are formula feeding, correct?
Yes.
Okay, so you're gonna want to feed them every 4 to 5 hours ish. And if they, sorry, I got a little confused. If they sleep for 4 to 5 hours or longer and they miss a feeding, you're just gonna want to wake them up, feed them, let them go back to bed.
Oh, okay.
Yeah, they'll take about 2 to 3 ounces of feeding in the beginning, and they need to eat every 3 to 4 hours. So you'll want to hold them close like you're doing now.
Okay.
And when you're feeding them, just don't prop the bottle up. You want to always hold it.
Okay.
You'll burp them every half an ounce, and that's you hold them over your shoulder and pat their back until they burp. Okay, so as far as like physical characteristics, if you see any rash or anything, that's very normal. The newborn rash that I'm talking about is like a small red circular areas with like a white dot in the middle.
Okay.
That'll go away within the first week. Just avoid lotions, powders, perfumes, soaps, that kind of thing. And then milia is these little pearly white bumps. I don't know.
I've noticed them.
Yes, they're normally on the face and their nose. They'll disappear within the first week. You don't really need to do anything. Don't pop them or anything like that. You know, I know. And then as far as jaundice, it's common in newborns. It's like a yellowish tinge of the skin. It starts in the face and goes down to the toes. That's fairly common in newborns, but if you're noticing they're getting more yellow in 24 hours, you'll want to call the provider.
Okay. I mean, baby here's green.
Yeah, she's
so.
looking a little green, but if she looks yellow-green instead of just
right.
regular green, that would be where we're concerned.
I got it.
Yeah. For bathing, you're going to want to sponge bathe until their cord falls off with just like a soft washcloth and plain water for their face. And then you wash from head to toe and then do the diaper area last.
Okay.
You can use mild soap on their body, just no soap on their face and private parts because they got very sensitive skin.
Okay.
For the cord, you're going to want to make sure it's clean and dry. You can just cleanse it with warm water and soap if it gets soiled, like from a diaper or whatever, but other than that, just inspect their skin and notify the health provider if there's changes like redness, bleeding, that sort of thing.
Okay.
Discharge. It should fall off within 2 weeks. And then for diapers, you're going to go through a lot of diapers in the next few years. Yeah, so in the first day, they should have 1 to 2 wet diapers in the first few days of life. And then from then on, it'll be about 6 to 8 wet diapers a day with 1 like soiled, dirty diaper a day with like bowel movements.
Okay.
It'll start as yellow-green, and then it'll change to more of a mustard yellow and soften a little bit. Yeah, it's a little gross, but poop is going to be part of your life now, unfortunately.
Okay.
A lot of people like to keep track of how often they're changing their diapers, how many wet diapers they go through a day, just to monitor fluid and nutrition status.
Okay.
You don't have to, but it is recommended, so that way you can, if the provider asks how they're eating, you can, let them know for that. And then you have a baby boy, correct?
Yes.
Yes. And we made the decision to get him circumcised?
Yes.
Okay.
That is correct.
So when you change his diaper, you're going to need to clean him front to back. Make sure that the creases and the folds down there are all clean. We want to prevent diaper rash, and then pat them dry and diaper them. As far as the penis itself, you're going to want to make sure to apply Vaseline gauze applied to the circumcision site with every diaper change.
Oh, okay.
Yeah. So the head of the penis will start as like very red, and then will change to have like a yellowish or sticky film. Sounds gross, very normal, I promise.
Okay.
If you see any like bright red bleeding or like a green discharge, you're going to want to report that to the provider, but the yellow sticky film is okay.
All right.
You'll just wipe it gently with a soft cloth, cotton swab, or gauze pad, and plain water, no soap or anything, don't worry about that. And then as far as dressing, like you're going to want to just dress him as you would yourself. So,
Oh, as a woman?
Of course.
Yeah.
Yeah.
Bows.
However you want to dress your baby is absolutely acceptable. Unless it's 80 degrees outside and you're putting them in a snuggie. They are so cute, the little ones with like that looks like a little bear and they're all fuzzy. Adorable, but we live in Florida and it's 80 degrees outside.
Yes.
So if you would be hot wearing that, baby would be hot wearing that. They're not great at regulating their temperatures yet, so we don't want them to overheat.
Okay.
Same thing with blankets. Having one blanket on is great, keeping them warm, but we don't want to bundle them up
especially in
too
this
much.
cold hospital.
Yes, it is chilly. And then the last thing is for your vaccines.
All of them.
Yes,
Getting
all
them
of them
all.
is recommended, and we'll talk to your provider.
Little baby here is going to be protected.
Good. So I think I hear hubby outside. Let me give you this.
Oh no.
If you have any questions,
Thank you.
let me know.
Yes.
If not, good luck, and we'll see you. Hopefully, we'll see you for your next one, maybe.
I don't know about that.
We'll see.